Hi there everyone, I'm Dr. Emma Foraker. Today we're going to be doing a training. I'm here at Beautiful Skin Denver, one of the med spas that I medical direct for, and we're talking about full face nerve blocks. We're going to be training on that today. So first thing I want to talk about here is that, this is really a procedure that should be done on very few patients. The patients that would be a good candidate for this, somebody who's very anxious, somebody has very low pain tolerance. This should never be a standard of care. This should be an exception when you've got somebody that really just has a very low pain tolerance and you need to be able to do RF microneedling or a deep CO2 laser, for example, or even filler sometimes. And what I want to say too is that the full face nerve block can be modified to, let's say if you have somebody that wants cheek filler, then you can only hit the infraorbital nerve, or chin filler, hit the mental foramen. And so this can be modified for whatever procedure you're doing, but today we're going to be talking about how to numb the entire face for a full RF microneedling, let's say, for example. So today, what we're going to do, what I want to talk about first is why is this something that we don't do on everyone? Well, lidocaine toxicity is a really real thing, and Sammy, as you know, we can cause arrhythmias that can be fatal with lidocaine toxicity. So for the average 140-pound patient, you can use up to about 13 cc's of lidocaine without getting into the range of systemic toxicity. So for somebody that's a little bit more than 140 pounds, like myself, I can take a little bit more, but I would say, and actually as a rule, I just want to throw it out there that let's keep 10 cc's of lidocaine per any size patient, and that way you have some wiggle room. If we keep it at 10 cc's or less, then you can also do some topical numbing. So for example, you might want to do some topical numbing prior to the nerve block in order to help with the analgesia from doing the actual nerve block. If somebody's anxious and doesn't want needles in their face, they're really not going to want a nerve block. So, and so you have to take into account the systemic absorption of the topical lidocaine and add that in. Even though we can't really quantify that, we have to take that into account when we're doing a nerve block so that we make sure we're not causing toxicity. Other risks with nerve blocks are, people are allergic to lidocaine, and allergies can come in a lot of different ways, including anaphylaxis. The other thing, you can cause permanent nerve damage with nerve blocks, and so this is not something we take lightly. And I really want to, emphasize to you at home that this is something that should be only done by trained medical professionals. This is not something you want to DIY on yourself if you're at home injecting filler into your own face. That's crazy. And yes, I cannot emphasize that there are risks with this procedure. This is not your first line. Topical numbing should always be first line for aesthetic procedures. This is a case where we're having somebody that really needs extra help in the analgesia department. One other risk I really want to touch on is that we're going to be injecting right near foramens, and let's say we accidentally inject into the infraorbital foramen or the supratrochlear. And what could happen is, if you accidentally inject your foramen, you now are causing pressure necrosis on that nerve that's traveling through that, And so even though we're going to be injecting around foramens, our goal is not to inject directly into a foramen, because that can actually lead to permanent nerve damage. So the importance of an informed consent, like the one I have here, I really cannot overstate how important that is. And this should be specifically for the nerve block, separate from whatever informed consent informed consent document you have for whatever procedure you're performing. Okay, so now we can move on. So I'm going to talk about the preparation next. Okay, so we're on to the preparation part. We're going to make a 10 cc solution with our Lido with epinephrine and with some sodium bicarb. We do this at a 10-to-1 bicarb ratio. So basically, you're going to make 9 cc's of Lido with epi with 1 cc of bicarb. And the reason we use bicarb is just because when we inject lidocaine with or without epinephrine, it's going to sting a little bit, and bicarb takes the edge off. And I want everyone to think about right now, why are we using lidocaine with epinephrine? Is it what do we typically use lidocaine with epinephrine for? Well, we usually use it when we want to decrease bleeding. And in some cases, we really do want to decrease bleeding when we're doing injections, so you don't end up with a big old bruise on your face like myself currently. But that's actually not the reason why we're doing this with a nerve block. So can we think about why are we using lidocaine with epinephrine in this case when we were just talking about systemic toxicity from lidocaine? I won't put you on the spot, Sammy, but basically, hopefully what you're thinking is by keeping the lidocaine local, we're not having systemic spread. We're clamping down those blood vessels. Now we have less systemic spread, so we can I said 10 cc's, we actually could go up to like 20 cc's without causing toxicity when you're using lido with epi, but we're playing it on the extreme safe side. So the idea is by using lidocaine with epinephrine, you keep it localized in the area and prevent systemic toxicity. So I don't even know if we have 10 cc's in here. I'll call it good. I'm using up all your lido with epi, so put that on your supply list. And so same idea. I mean, we're pretty close to 9, and so. But if you wanted to make a 5 cc mixture, obviously, then you would put a half cc of bicarb. So you can you don't always have to make such a large amount. And then as far as injecting, what we're going to use is, around like a 27 to 30 gauge needle for the patient's comfort.
Which one do you prefer?
30, if you're nice. Yeah, I think we probably should be. I just met Melissa. She's been pretty nice to me. I don't want to piss her off quite yet. She's giving me free laser treatment on my bruise. Okay, and then that's pretty much. Do you guys have any questions about the preparation of the solution here? It's pretty straightforward. And then what we're going to start with is I'm going to show you this document that I created. It's very beautiful, I know. Really high tech here. So basically what we're going to be doing is we're going to be doing a CC at every one of these midline foramen. So we've got the supraorbital foramen, we've got the infraorbital foramen, and the mental foramen, and each one of these is going to get 1 cc directly. And then the rest of these kind of spots on the outer edge of the face, you've got your zygomatical facial artery, you've got your buccal artery, I'm sorry, I'm saying arteries and I meant to say nerves. But the idea is, we still will do some blebs around the face to kind of cause anesthesia, but these 3 main ones are, in the mid-pupillary line, kind of, a little bit medial to that. And once we really knock those out, we're getting a lot of anesthesia to basically the mid part of the face, but we still have to just do a little bit on the outside. And like I said, the neck would need to be done if we were treating the neck. So we'll go ahead and get injecting. It's important to always be at the head of the patient when you're injecting, and the real reason for that is that you do not want to inject lidocaine directly into the orbit. And so when we're anesthetizing the supraorbital foramen, that's where you want to be coming from above, as opposed to obviously coming from below, which then could inadvertently inject the orbit. So I'm just going to quickly talk about these landmarks, and so we're not injecting at Melissa. So I want everyone at home to feel on their selves where you feel this supratrochlear notch, I think it's called, but it's basically a notch in your orbit that you're going to feel right about here at the very medial part of your eyebrow. And that's where these 2 nerves come from. They've got the supratrochlear nerve, we've got this supraorbital nerve that supply the forehead. So I'm basically going to do a ring block in this area to try to anesthetize both of these nerves here. So that's number 1. We're going to do 1 cc at this area. Number 2, you're going to find the infraorbital foramen, which is in your cheek. It's about at the mid-pupillary line. Open your eyes for me, Melissa. It's actually kind of at the inner part of the iris. It's not quite mid-pupillary, a little bit medial to that, but it's usually about here. And if you're an injector, you probably know this because you like to avoid it so you don't get a big bruise like me. And so same idea. This is going to anesthetize all of this area to the upper lip. And then lastly, we're finding the mental foramen, where we find that here. And so if you can feel it on yourself, that little area where it's kind of a divot here, and this is going to anesthetize the lower face here. So these are your 3 main points. Each of these points is going to get 1 cc of our solution, and then we'll talk about how we kind of get these other zygomatical facial, the buccal nerves. We'll kind of anesthetize those with these little blebs, but these are the main nerve blocks that we're performing. So,
do you have markings on this one?
Sorry?
Do you have did it actually mark me?
Mm-hmm.
Okay.
And I don't actually need the markings.
I know you don't, but I'm thinking other
for
people.
other people. Yeah. Okay, so
I'm thinking more stuff specifically.
yep. So we're going bevel up, of course, down to bone. We're going to go right above that Raymond, and we're doing 1 cc.
Can I ask a question?
Of course.
Is Sammy gonna be able to do the other half?
Yeah.
Listen, you wanna?
It was easy as that. That wasn't too bad, right? That was pretty. So with the bicarb in there, it's really not that bad. But like
Just
I said,
the needle.
in most
The
cases,
needle's
yeah,
not bad to me.
not too bad. At 30 gauge, it's not too bad. And so same thing, when we're on infraorbital, we're going to go down to bone just like we did here. And in this case, it doesn't matter to be at the head of the patient. So here we go, 1, 2, 3, poke. No need to aspirate. We're not worried about causing any vascular occlusions here, obviously. That's 1 cc.
So do you have to be, how close do you have to be to that? Are you exactly in an exact spot,
Nope.
or is it just pretty much
Nope.
in the region?
Essentially, think of it as a ring block. As long as you're within a 1 centimeter square,
Okay.
1 square centimeter area around where the nerve comes out, you're going to hit that nerve. So you don't have to worry. And again, like we talked about, we don't actually want to be right where the nerve comes out, because then we could accidentally inject into the frame, and that's a no-go because
Right.
of what we talked about, the pressure necrosis. So yeah, same thing here. We're going down to bone, 1, 2, 3.
So you're actually hitting her bone?
Mm-hmm.
Okay.
It's easy as that. And then for these tiny little blips.
Hey, me, get to be numb.
Yep. How are you feeling? Already feeling
Oh,
it?
yeah.
Oh, yeah. And so, yeah, there's a few of these branches that we want to hit. And there's really, you don't have to be very precise about this, but what I would do is just little blebs, maybe 0.2 of, so just kind of like this. Here we go. And this is to get the rest of the cutaneous nerves that aren't going to be treated with just these nerve blocks. So I'm just doing tiny little blebs here. The auricular nerves that come out here, preauricular nerves, the buccal nerves. And then, like I was saying before, if we were going to be treating her neck today, I would then go bink, bink, bink.
Okay.
So
you're not going down to bone on those?
no,
It's
these
under
are
the
just
skin. Okay.
cutaneous, and again, little blebs is what I would call that. So, and then if we were going to be doing something with her lips today, we could also add a little bit extra to each side of inside of her mouth to do like a true digital, or sorry, to, what am I calling? What's that called? Oh my gosh, for lip filler. When we're doing a lip lock. I don't know why I just totally spaced that out. But when we're injecting into this, so I'm not going to do it to you, Melissa, but I'm just going to show how I would do that. You go to the canine, you go up into the mucosa.
Or doing a dental block.
A dental block. Oh my gosh.
Oh, okay.
Thank you. I don't
thought you
know
were
why
looking for
my
something
brain
more
just farted.
complicated.
It was the really spicy tacos that I had. I can't think straight. And so same thing down here on canine at the bottom of the mucosa, and that really is going to make sure
So
we
you're
get
just
the
going
lips.
into the mucosa. You're not,
Mhm.
okay.
But this and this and this and this numb. Like this whole
yes.
part of my lip is numb.
Yes, it is gonna, with the infraorbital, it is gonna get to like most of the white lip. The mental is gonna get most of the lip. If we were truly injecting into lips, we probably would still want to add those little bit because we're not gonna get the inner lips as much with these. But technically, you're right. Most of it, you
I
should
didn't feel anything. When
You
she
still
did it.
feel.
No, I'm saying when she did it.
Oh,
here
right,
and
right,
here, I literally, the only time I felt anything was like a level 1 here. Otherwise,
Right.
I couldn't even tell she was doing my lips.
Right.
Is your lip numb now?
Upper, not yet. Bottom, yes.
Okay.
Yeah, and so you could even do, you don't have to go inside of the mouth when we're doing dental blocks.
I was
You
going to
can,
say, can you do it on the outside?
You can.
Okay.
yeah, but we're not gonna do that because we're not actually doing anything with her lips today, and we're just learning how to do a full face nerve block. But I just wanted to point that out, that if we really are doing a lot with the lips, we would want to add that because in order to get the entire lip anesthetized and the tip of the nose. But again, we're not doing that today, but just add that to your procedure if that's what you're doing, something with the lips and the nose. So if you want to go ahead.
Okay.
We're all done with the nerve block procedure. Melissa, are you feeling pretty numb?
Yep.
Okay. So some side effects that you might see right then and there is that it does look like she's having a stroke, and that's just because of the motor nerves being so it's facial asymmetry. Obviously numbness is all expected, and so if you have any questions about the nerve block procedure, please let me know in the comments below. It can be a very useful tool in our aesthetic toolbox for procedures. But again, I really want to emphasize this is not something you should be doing for every single patient. But if you have any questions, please let me know.